Hi, everyone. Welcome back. My name is Dr. Samantha, and I'm the maternity mentor. And we're here for another one of our live Q&A sessions that we have on Mondays at 9 p.m. Eastern Standard Time. So this is a chance for you guys to ask any questions that you have of me. You can put them into the chat. Remember, please like and subscribe to the channel. Subscribing to the channel really helps me as a creator and content provider out. Remember, you can also follow over on YouTube, Instagram, and Twitter. We'll link those in the description for additional content. Share the channel with your friends and family, and please hit the notification bell so you can get notified of our latest content coming out. One of the things I like to do here is I like to answer any of the questions that you guys have submitted onto the videos this week, as well as anything that you have live. And just for anybody new who's joining us, I want to let you know that we have now been approved to be part of the YouTube Health platform. This is an area of YouTube that YouTube has created where you as viewers can go to that section and know that you're looking at verified content from verified healthcare providers like myself. So any questions that you have, please feel free to put into the chat. And I'm going to go ahead and get started with some of the questions that we had on some of the videos this week. Now, this week we had a ton of bleeding questions. Bleeding is very, very scary during pregnancy. It's something that it's probably the number one question that I get asked because it is so like nerve-wracking to know whether what's going on is safe or not safe, and unfortunately whether you might be having a miscarriage, which is what's on everybody's mind. So we had a couple questions that I'm going to start out with. I am 10 weeks pregnant with brown discharge that will not stop. And another one said, I'm 5 weeks and I'm having red and brown spotting. It's not heavy. It's kind of like discharge. So these are two really good questions to start with. So both of these viewers are in the first trimester, 5 weeks to 10 weeks. So it is actually pretty common in the first trimester to have bleeding and that bleeding to be potentially normal. So there are many reasons why you might bleed. So let's start. So the first thing is you might still have your period. Your body does not necessarily completely kick into gear when you first are pregnant for a variety of reasons. So some people will actually have 1 or 2 full menstrual cycles before they stop bleeding regularly. So that can be considered normal. And everybody's different as to whether this happens. But just so you guys know, a lot of people who won't find out they're pregnant until say 8, 9, 10 weeks along, it's because they were getting a period and they didn't realize that they were actually pregnant. Now, second to that, once you have an egg that is fertilized, that egg travels down through the fallopian tube and into the uterus, and it needs to implant into the uterine wall. When that happens, there can be something called implantation bleeding. And implantation bleeding is basically just a little bit of blood that comes from that uterine wall shedding where the egg implanted. Now, this can be completely normal, and it usually happens pretty early on. But like for the person who's 5 weeks pregnant, a lot of people think they know their exact due date and they don't always. It is variable. Even if you have an ultrasound, pretty much the only people who know exactly when they got pregnant is somebody who's using IVF. So implantation bleeding can be completely normal, and it is something that you may see. Now, when you're pregnant, the hormones that drive a healthy pregnancy thin out vaginal tissue. So it is very common when women have sex that they may see some spotting and or bleeding because the vaginal tissue is so thin and can tear easily. This is why it's super important that when you are having sex, you make sure that you're well lubricated or use a lubrication jelly. That's really, really important to healthy sex during pregnancy, guys. Now, after that, we have a couple other reasons why you might see some bleeding. And so one of those is something called a subchorionic hemorrhage. And so we had a patient, we had a viewer who wrote on the subchorionic hemorrhage video, which we'll link into the description, that said, I'm 14 weeks and I was told I have a subchorionic hemorrhage at my 8th week scan, but I am not bleeding. What does this mean? So when you guys go and see bleeding, you need to go to your healthcare provider and get assessed, because one of the things that we need to do is we need to see what's going on. And a common part of that assessment is an ultrasound. So the ultrasound looks to see if they see the baby, if they see a heartbeat, if they see if the baby's in the right location, all this other stuff. And it can check the placenta. And so the placenta is the organ that's going to feed your baby, and it attaches to the uterine wall like this. And the uterine wall has a whole bunch of blood vessels, and the placenta has a whole bunch of blood vessels. So when this attaches, sometimes you'll get a little pooling of blood underneath. That's called a subchorionic hemorrhage. It's basically kind of like a bruise underneath the placenta, right? So sometimes a little bit of that blood will seep out, and that's where you get bleeding from a subchorionic hemorrhage. It is actually pretty normal, okay? It's more common than we think, and subchorionic hemorrhages are usually not an issue at all. They're usually something that is very benign and will just go away on its own. In fact, most of them will resolve on their own. So that is another potential cause of bleeding in the first trimester. Now, these questions all reference a couple different colors. And so we have a video that goes over the colors of bleeding that we can link into the description. But as far as colors go, what we have is pink, which is usually blood that's mixed with like some kind of secretion, like normal vaginal fluid or something like that. Then you have red, and bright red and dark red are usually signs of active bleeding. And then you have brown. Brown is old blood. This is blood that's coming out, but the bleeding has stopped. So you will see all these different shades, and they do tell us a piece of the picture of what's going on. But just because you see brown, you can't assume that everything's okay. You still want to contact your healthcare provider and let them check you out, because we need to make sure that we can rule out things that might be causing some of this bleeding that are not normal and we can take care of. So we had a question that was on the bleeding videos, and it said, one discharge bleeding after taking Dufaston during early pregnancy, is this normal? So Dufaston is a progesterone supplement. Progesterone is a hormone that is needed for a healthy pregnancy. And so for some women, they will be given progesterone supplements in the form of capsules that they insert into the vagina. So when you're inserting any kind of medication into the vagina, it can cause vaginal irritation and sometimes bleeding. Also, some of the medications that are hormonal based can cause uterine bleeding as well. So it is potentially normal for you to have bleeding after the insertion of progesterone. However, I cannot stress this enough. You guys need to contact your healthcare provider if you see any bleeding, because there are certain things that we can take care of. Now, this is an example of somebody who really needs to call the doctor. I was 7 days late for my period, and I started to see blood at the end of my urinating yesterday, like a couple of drops. Then about 2 hours, there wasn't any more. And then after that, I started to see pink and dark red while urinating. I then put on a pad and there wasn't any blood coming out. Today, I see dark red when urinating. I've had a pad on all night and there wasn't anything coming out. So now I'm kind of confused. I still feel pregnant. I have a ton of gas, lightheaded, feeling like I'm about to faint, tired a lot, flutters in my stomach, and eating more than usual. Bleeding gums. Please help me. I just want some guidance, as this could be, is this possible that this is an early miscarriage? So this was a great question, because this starts to highlight where you can get confused about what's causing the bleeding and what are other things that we can take care of. So blood in the urine. When you see blood in the urine, this can actually be a sign of a urinary tract infection. And urinary tract infections can cause bleeding. And that's because the urinary tract infection is usually getting worse. When it gets worse, you can actually end up with pyelonephritis, which is a kidney infection. So you have your bladder, and there's a little tube from the bladder out to the vagina called the urethra. And the urethra is really short. And so it's really easy for bacteria to go up into the bladder. And then in the bladder, it gets to sit there and grow. So that bladder is a nice, warm, dark environment. It's perfect for bacterial growth. And then when you're pregnant, you have a baby sitting on that area. So you can't always empty the bladder completely, which leaves that bacteria in there. Now, when you just get an infection in the bladder, this is a urinary tract infection. However, if it gets a chance to spread, it goes out through 2 ureters. 1, 2. These ureters are, again, small tubes that travel up to the kidney. So you have 2 kidneys. Now, if you get an infection inside the kidney, this becomes a much more serious issue. This is where you can end up with a systemic infection. It's a blood infection called sepsis. And if left untreated, this can lead to organ failure in mom, and it can lead to a miscarriage or stillbirth for the baby. So it's really, really important that we treat you. And usually we have to treat you with IV antibiotics at that point, which means you have to go into the hospital. And one of the signs of that can be bleeding because the kidneys are shutting down. So this is a really good example of where if you're seeing blood, you need to make sure you're coming in to let us check you out, and so we can give you the right treatment for that bleeding. For those of you who are joining us, please feel free to put any of your questions into the chat. Right now, I'm kind of answering questions that came in off of some of the videos this week. So now we have a urinary tract infection. So how do we treat that? We usually treat it with antibiotics. So let me get into some of the antibiotic questions. So I have a question that said, I'm 22 weeks along and I've been prescribed cefuroxime axetol 500 milligrams twice a day for 5 days. Is it safe for me and the baby? So I love antibiotic questions. I think this is a very important topic that a lot of us need to talk about. So antibiotics are medications that treat bacteria. They do not treat yeast. They do not treat fungus. They do not treat viruses. They only treat bacteria. It is very important that before we use an antibiotic that we know where you have a bacterial infection to treat. So once we know that there is a bacterial infection to treat, we will prescribe an antibiotic. During pregnancy, one of the most common times that we will prescribe antibiotics is for urinary tract infections. Urinary tract infections can lead to preterm birth, stillbirth, and miscarriage. I cannot tell you how many women that we have seen come in labor and they had a urinary tract infection and ended up having a premature baby because that infection couldn't be stopped. So how do we treat that? So we treat it with antibiotics. So how does an antibiotic work? So imagine you've got this whole huge army of bacteria and they're in lines, okay? And you give antibiotics and the antibiotics are coming in to take out the bacteria. So they're taking out the first lines of defense. Well, these guys back here are paying attention and they're like trying to figure out how this works and what can they do about it. Now, you start your antibiotic, and one of the brilliant things about antibiotics is within about 24 hours, you start to feel better. So you go from being sick to feeling amazing. This is where a lot of people make a mistake. They stop taking the medication. And pregnant women are notorious for this. They feel bad, they're worried about the baby, which is okay, it's understandable, but they're not sure. So they're like, oh, well, I feel better, so I must not need it anymore. So they stop. So now this bacteria back here, this bacteria was like paying really close attention. So they're like, I know how to get around that. I'm going to build a big wall, a wall of defense. They do that and call in reinforcements. So now you start to feel worse again. And you're like, oh man, I think I needed to take that antibiotic. So you start taking it again. But this time it doesn't work because there's a big wall in your way. And so as a result, that leads to antibiotic resistance. The antibiotic we originally prescribed will no longer work for you, and now we need to use something stronger. So the thing is, when you are given a medication and you decide that you're going to take it, it is very important to take it completely, even when you start to feel better. Now, a lot of people think, oh, well, I can treat my urinary tract infection homeopathically. So one of the most common things is, oh, you can cure urinary tract infection with cranberry. One of the things you guys need to know, and a lot of people don't realize this, is pregnant women are considered immunocompromised. So our immune systems, if they were at full strength, would be very hyper aware of the baby that's growing inside. That baby is not completely genetically identical to you. So it is a foreign body. And so the immune system would probably spend a lot of time attacking your placenta and your baby, and because it doesn't think it should be there. So our immune systems have to kind of be calmed down, okay? We're more susceptible to getting all sorts of infections. Now, that's why urinary tract infections are particularly common. But in addition to that, once the infection is there, these infections speed up fast. Where somebody else might not get sick for a week, they might just have little symptoms here and there. Pregnant women can go into full-blown sepsis within 24 hours. So it's really, really important that we head these things off. Now, cranberry juice does not treat urinary tract infection, guys. It does not. Period. End of conversation. Very rarely, somebody who's very in tune with their body can get the early symptoms of a urinary tract infection. They can drink a ton of cranberry juice and they might stave off or hold it off, but that is not treatment and that is not the normal. That is not the common. Now, cranberry juice does serve a purpose in prevention. Cranberry juice is highly acidic. And what we found is that when you drink a lot of cranberry juice, it acidifies the urine, which makes the bladder inhospitable. It's not a nice place for the bacteria to be anymore, and they can't really grow. So if you drink lots and lots of fluid and cranberry juice, and we're talking the real cranberry juice, we're talking like full cranberry juice, no added sugar, not ocean spray. If you drink that, it can help prevent. Now, the thing is also, just so you guys know, if you have gestational diabetes or if you're postpartum and you have gained a lot more weight than you expected and you're worried about diabetes, you can't drink cranberry juice. It's full of sugar, okay? But it is a potential preventative, but it is not a treatment, okay? And then going to this question, is cefuroxime acetal, which is an antibiotic, safe for use during pregnancy? Yes, it is safe. For those of you who are joining us, please feel free to put your questions into the chat. We have another question that kind of touches along some of this stuff. So it says, I'm in my second trimester of pregnancy. At my first pregnancy, due to urine infection and typhoid fever, my baby died in the womb after 9 months and was delivered by C-section. And I'm really sorry to hear that. That had to have been really, really hard. Now I'm 6 months pregnant and I have the same urine infection and fever. At the second month, the doctor suggested nitrofurantoin tablets and probiotics. At 4 months, Leptospira test, that's a type of bacteria, is positive. That time I used amoxicillin. Now I'm in my 6th month again and I have a urine infection, but every time I've taken 5 to 6 liters of water per day. On this month, the doctor suggested I have a TIFA scan and the radiologist told me the amniotic fluid is 20. I think a TIFA scan where you are coming from is an ultrasound. So shall I stop drinking 5 to 6 liters of water per day or not? And using the nitrofurantoin antibiotics during the first trimester, is it okay for the baby? So nitrofurantoin is macrobid. There's some controversial evidence to go here or there about it, but most of the evidence says it's safe. I've seen it used many, many times during pregnancy. Macrobid is one of the best antibiotics for a urinary tract infection. And urinary tract infections can be so devastating for a pregnancy that we do commonly use it. So it's a risk versus benefits medication, but we usually use it and I haven't seen any problems. Now, as for drinking lots of fluids, I do recommend everybody drink lots of fluids. Flushing your system can help to alleviate some of that like bacteria. The more you pee, the more you're peeing it out. So that can definitely help. Now, amniotic fluid index. So amniotic fluid is the fluid that surrounds the baby, right? That's the bubble the baby lives in inside your belly. When you have a higher amniotic fluid, we get worried about, which is polyhydramnios. There's oligohydramnios, which is low, and then poly, which is high. We get worried about what's going on with the baby. And yes, your hydration to a certain extent does help with your amount of amniotic fluid. However, amniotic fluid is mostly made by the baby themselves. It's basically their pee. And so when we see a higher amniotic fluid, we want to look to make sure there's a couple of things that aren't going on. One of those being gestational diabetes. When you have gestational diabetes, it is more common for you to have more amniotic fluid, which can lead to complications during pregnancy. So we very much want to find out what's going on. If you're in your 6th month of pregnancy, this is about the time that we would do that sugar test and see if you are in fact positive. So this would be one thing that I'd be telling you to make sure that they've tested you for. Now, the other thing is you want to make sure that you have an anatomy. Sorry, the word escaped me for a minute. An anatomy scan, that's the anatomy ultrasound. It looks at all the baby's organs and the bones and all that stuff. You want to make sure you have one of those as well to check the baby's kidneys. Kidney abnormalities can also affect the baby's amniotic fluid. So that's another thing to get checked out. So would I say stop stop drinking all this fluid? Not necessarily, and definitely not without talking to your healthcare provider first. And finally, recurrent urinary tract infections, unfortunately, are very common. This is something we see a lot of. And so one of the things I tell moms is that you should be followed by a maternal fetal medicine physician. A maternal fetal medicine physician is the high risk pregnancy doctors. These are the ones that take care of moms that have pregnancy complications. You also want to be referred to possibly a urogynecologist. These are the guys these are the people who specialize in the urinary system related to gynecology, because you want to see what's going on and why you have these recurrent infections. There may be something that they can do about them. For those of you who are joining us, hi, I'm Dr. Samantha. Please feel free to put your questions into the chat. I'm currently right now answering some of the questions that have been submitted on some of the videos this week, but please feel free to put stuff into the chat. So we had some second trimester bleeding questions. So now we're talking, basically from about 12 weeks to about 24 weeks, 26 weeks of pregnancy. So I'm 17 weeks pregnant. In the first trimester, I had a subchorionic hemorrhage, but it is fine now with 2 weeks of medication. Now me and my husband had intercourse and I had brown discharge after, but there were no other symptoms. I'm worried. And then the second question is, I'm 27 weeks pregnant with my first, and I just now spotted pink blood. There wasn't a lot. Should I worry? Okay, so these are two great questions. So when you get into the second trimester, we start to get a little bit more worried about bleeding, but we're not like freaking out. Little bits of spotting should still be reported to your healthcare provider, but they can be normal. And I would go to the first question as one of the main reasons why it could be normal, which is sex. Now, just so you guys are aware, because the first question mentions a subchorionic hemorrhage that resolved with 2 weeks of medication. I'm going to tell you so that you guys are not confused. There is no medication that I am aware of that can treat a subchorionic hemorrhage. So that medication was probably treating something else in addition to the subchorionic hemorrhage, but without more information, I wouldn't be able to say. Okay, so let's talk about sex. So it is very common for people to bleed after sex, women to bleed after sex, especially during pregnancy. There can be a variety of reasons, the most common being that the tissue is tearing. Now, one of the reasons why it's so important to talk about this is preventable. Okay, so it is preventable by a couple different means. So the first thing is lubrication, as I mentioned before. Using a lubricating jelly or something like that is essential. Your vaginal secretions are very different during pregnancy. They are not the same. And therefore, even when you are aroused, you may not have the same lubrication you normally do. Now, second to that is arousal. Okay. It is very important for a pregnant vagina to be warmed up. Okay. I know a lot of people don't like to talk about sex like this, but it's very, very normal. So you need to have a discussion with your partner about making sure that there's plenty of foreplay. So the vagina has a lot of blood flow to it, right? And that's like normal. There's lots and lots of blood flow. But if you think about it, during pregnancy, you got this human being that you're growing that's just north of your vagina and needs a lot of blood on its own. And so the vagina still has tons of blood flow, but it's different. And so if you aren't warmed up, if you haven't caused all those blood vessels in the vagina to kind of open up and ask for more blood to come, that's what happens when you're getting aroused before an orgasm, is you get a lot of swelling to the vagina because there's a lot of blood flow there, right? If you don't get that going, the vagina is also stiff. It's not soft and squishy like it normally is when you're aroused. It's stiffer. So then if you're stiff, that will also cause some abrasive rubbing, which can lead to bleeding. So it's really, really important to also be very aroused before penetration. Then, when we're talking about sex, there's all different types of sex, including oral sex, including using like fingers, including using like toys, all different types of stuff. So, while you may have been used to one type of activity before you were pregnant, things may have changed afterwards. So again, for example, using a toy. Toys are not somebody's hand. They can be like very rigid. They're a very defined shape. And with the changes in the vagina, that may no longer be comfortable for penetrative sex. So these are all some of the things that you guys should be aware of. So when you are having sex, you also need to talk to your partner. You want to make sure you're having an open dialogue. And if something doesn't feel good, switch it up. You may need to switch positions and different things because that may be more comfortable for you. And so these are really important things to happen. And this is some of the most common causes of bleeding. Now, if you think you were bleeding because of having sex, you still want to call your healthcare provider. You want to let them know, and they're going to basically probably mark it in your chart. They may do an ultrasound just to make sure everything's okay, and then they're going to give you guidelines of when to call back. Okay, but you don't want to just assume. Okay. For those of you who are joining us, hi, I'm Dr. Samantha, the maternity mentor. We're here for another one of our live Q&A sessions. I want you guys, please feel free to put your questions in the chat. Don't be shy. I get lots of questions every week there, and I love them. Right now, I'm kind of going through some of the questions that we have had put onto videos on the channel. So please feel free to put any questions into the chat that you would like. Okay, so we had a question. I'm just making sure. We had a question on the blood pressure video. So, can I take edarbichlor? Ugh, I don't even know if I'm saying it right. 40-25 and labetalol 200 tablets together. So the first one is a medication that's actually made up of two medications. This is very common for blood pressure medications, that they'll combine two different types into one pill. So it actually is a blood pressure medication called azilsartan, and then it's like a diuretic called chlorthalidone. So that first name is the brand name. So this is a newer medication, so there is not any data to say whether it is safe or not for pregnancy. So you guys know, we can't do studies on pregnant women and we can't do studies on breastfeeding women. It's not ethical. So most of the data that gets collected has to be collected based on the chemical molecule, fat solubility, half-life, um, animal studies, theoretical stuff that they've seen from pregnant women who've used these medications, like all this other stuff. So we can't actually 100% say. We have to make kind of like our best guess. And there's a lot of risk versus benefit. Blood pressure that's left uncontrolled during pregnancy can be devastating. It can really be a very bad situation, and it can be life-threatening for mom. And if mom was to develop really high blood pressure and eclampsia, she can start to have seizures, and then that becomes life-threatening for the baby. So we really need to make sure blood pressure is kept under control. So now, okay, the two medications I'm going to separate them, because the chlorthalidone, that one is known on its own. That is a diuretic. Diuretics are completely contraindicated in breastfeeding. So what does a diuretic do? It basically, this is the one that everybody calls the pee pill. This is the one that basically pulls fluid out of your tissues and you pee them out, right? So the thing is that this medication can build up. It's got a very, very long half-life, and it can build up to toxic levels in the baby, causing dehydration and death. So for moms who want to breastfeed, they cannot use this medication postpartum. So, I would take that into account. I would definitely be having a conversation about risks versus benefits with your healthcare provider and find out why they've chosen this particular medication, because there's a lot of other medications out there. Labetalol, for example, was the other medication. And this medication is commonly used during pregnancy. I've seen it many, many times. It's a beta blocker. It's a great drug. It's really good at controlling it. We often see this used in combination with Procardia, which is a different type of blood pressure medication. And labetalol is nice because it can be dosed 3 times a day. It can go pretty high. It's really, really a solid blood pressure medication. So, this one is great. And that's why I say for the other one, which I haven't seen used in practice here, you would want to say, like, why am I being put on this one when I could go higher on this medication, or are there other meds? Let them tell you why they're looking at what they're looking at. All right. So I am down to my last 3 questions, but I kind of left them all at the end because this is one of my passion areas. Again, please feel free to put any questions you have into the chat. So the first one, it was a comment, and it said that it was on my baby blues video, and it said, "This is so me, 100% baby blues, anxiety, irritation, and also crying randomly." So, for those of you who aren't aware, my background starts in mother, baby, and postpartum labor, delivery, NICU. I spent 13 years in that area, and I've been a lactation consultant for 12 years. I've done perinatal bereavement, but I moved from there into psychiatry. So when I was working with families, I saw how much families were being affected by depression, anxiety, OCD, PTSD. And I say families because part of what I did during my doctoral project was postpartum depression in fathers. So I have studied this whole area very extensively. This is where I'm passionate. And it's really important to address mood issues head on because there's so many options for treatment. I see pregnant and postpartum women every single day now, because more and more women and men, I see men too actually, are starting to recognize that they need help. And it can be hard. It's really hard to find the right combo for every patient, but it's something that I work very hard towards. And so let's understand what this person means. So first of all, let's just make sure everybody's clear. Baby blues lasts up to about 10 to 12 days postpartum. This is a mood that's extremely variable. I mean, literally 1 second you can be crying, then you can be laughing, then you can be yelling, then you can be like so tired you can't keep your head up because you're so depressed. It is just like random. It's random chaos. Imagine your mood as chaos. That's the baby blues. They're usually not detrimental. It goes away. Very normal. That's hormonal. That is what you traditionally hear of as hormonal mood changes postpartum. So now let's talk about what's next. So what's next is where we dive into the realm of mood disorders. Now, in this particular comment, she says anxiety and irritation. Separates out irritation from anxiety. But what I want you guys to know is irritation is a form of anxiety. So anxiety is fight or flight, okay? So flight is the worry, the intrusive thoughts, the agoraphobia, the social phobia, the claustrophobia, the panic attacks. That is flight. We're all cavemen. I love talking about cavemen. So we're all cavemen, right? And so back in the day, when a saber-toothed tiger jumps out in front of us, we have fight or flight. So the flight is that I'm scared and I'm running away. Anxiety, right? But wait, fight. Fight is the I'm going to attack. I'm going to defend myself. The anger, the irritation, the aggression, the rage. Ever hear of postpartum rage? Rage. Well, you're still scared. I mean, it's saber-toothed tiger. Your life's in danger. You've just chosen to fight. That's anxiety. It's one and the same. We always hear this expression, fight or flight, but I don't think people really conceptualize the idea that the fight response is still anxiety. Something has changed. You don't like it. It's not good for your environment right now, so you fight. Okay? It is very important to address this. Most of the time, the biggest culprit to making everything worse is lack of sleep. I stress sleep so much with my patients because if you don't sleep, your brain is not resting. If your brain is not resting, you cannot function properly. So it is extremely important that you are getting proper sleep. That is the number one thing I focus on. Sleep is essential. Now, in addition to like a lot of the homeopathic stuff, self-care, asking for help from family and friends, doing these nice things like eating well, sleep, exercise. In addition to all this, we have medications, right? So medications get this really, really bad rap. So the first thing you need to know is there's tons of medications and supplements that you can use that are safe for pregnancy and breastfeeding. A lot of people get worried about changing who they are. Okay. They're worried that it's going to make them a different person. So if you are medicated properly, if I do my job well, you are still you. See, my job isn't to make everything go away. I shouldn't make you numb, and you should still feel everything. In fact, I tell my patients, you should feel normal human emotions. You are a human being. You should feel love and humor and anger and irritability and sadness and depression and anxiety. These are all normal for human beings to experience. The difference is when you feel out of control postpartum or pregnant with your mood, things are at 1,000. Okay, you have all these emotions times 1,000. And especially like the anxieties and the depressions and the OCDs, those are like so high, right? And they drown out some of the other stuff like the happiness, right? when I give you Lexapro or Zoloft or Prozac or whatever I do, right? I'm not trying to like take you away. I'm trying to take that amplification and bring it back into the normal human emotion range. So understand when you're working with a provider who's trying to give you medication, that's what they should be doing. We should not be numbing you. We should not be over medicating you. Instead, we should be turning the volume down so that the other stuff kind of can open up and be louder and it all balances out. So now we have a question on a postpartum depression in fathers video. This was one of the videos that I put out because, like I told you guys, I am very passionate about both. And it said, hearing the symptoms and effects are triggering me. It's really hard. Mine was brought on by thoughts of losing out in life due to my child. It wasn't brought on by that. It was due to the person I had the child with. They were not supportive at all because they're female, their wants and needs matter. And so I thought this is a very telling comment. And so I need the next things that I say I really try to stress this. So when a woman has a baby, what do we hear all the time? It's all about her. Everybody talks about that. It's all about her. And especially for partners, I know I use dads here and moms, but just, this is really inclusive to anybody. But when we hear like she's about to deliver and you need to help out, it's always help the mom, help the mom. This is all about the mom. She just grew a human being. She had to go through all this labor. She's in a lot of pain. Everything's about her. Nope. I disagree. So, yes, it's like 95% her show. I'm not going to lie about that. There's a lot that goes into giving birth to a baby and recovering. However, partners, fathers, they need support too. How can you possibly give if you aren't receiving? So they're just as essential as moms for making sure there's self-care. Now, a new dad can't just run out and do everything that they used to do. It doesn't work that way, but it doesn't work that way for mom either. So there is a new balance, but that balance can be achieved. It is very common that I see that my dads like to exercise. I hear this a lot. And so I have a lot of families that I'm working with where the dads are trying to make sure they get their exercise in so they can be on for everything else. And because the mom gives them that time, these families are more successful in their postpartum recovery. I actually see them thriving because he gets this one spot to do what he really needs to do. And then even though he may come home tired or whatever, he's on because she gave him that. And she needs him to be on because she may just need a break, right? So it's a balance. And it's not going to be the way it always was, but it's so important that we recognize that dads need help. Now, the other thing is that once a woman has been diagnosed with a mood disorder, the dad is 50% likely, has a 50% chance of developing a postpartum mood disorder as well. So you need to understand that there's huge risks here. It's very comorbid and it can be very debilitating for the family. So then this is the last comment that I had. The first time my wife and I found out that we were pregnant, my reaction wasn't what she wanted. I was shocked, scared, and nervous all in one. And she was the excited one. I tried to be excited, and I'm trying harder to be excited now. But for her, the damage has already been done, and she is having second thoughts about everything. How do I fix this and be more supportive for her? How do I show her that I really am excited and happy now to hopefully heal my original screw up? I don't want her to feel like this, and we both didn't want this, so I could really use some advice for first-time parents. So I would tell this dad That is a very normal human response. And furthermore, that is a very normal dad response. So moms, we tend to be the multitaskers. We tend to be the ones doing all these little nitty gritty details. And therefore, we tend to be hyper alert and focused on such small picture things, right? I mean, we're smart. We can do big picture just like dads can do small picture, but you know what I mean. This is because back in the day, and I hate gender roles, but we're going with it. Back in the day, in the caves, we're cavemen. Okay, women were at home in the caves. Women were there, and we had to take care of children and make cook meals and gather stuff and gather firewood and make all the stuff, right? And on top of it, we had to make sure our kids didn't die, wander off, get eaten by animals. So we were constantly hyper vigilant and looking everywhere. So just so you guys know, for you ladies who get very hypervigilant postpartum, that's where it's coming from. That like irrational, like, oh my God, I got to look here, I got to look there. That's where it came from. You are genetically like predisposition to keep this human being alive, because that means the human race will survive. So this is where that comes from, that hypervigilance. Now, dads, when we were in caves, they went out. Their job was to hunt. Okay. They had to bring back food, because ultimately, if they didn't bring back food, no human beings either. So they had a completely different focus. It was very big picture planning. Okay. If you're going to go hunt a woolly mammoth, that requires some planning. How are you going to do it? How long are you going to be out? How are you going to leave the family? Right. So it required planning and logistics and big picture thinking. And they did not think about the little stuff. That was not even in their wheelhouse, right? Okay. So now we go to this dad. And this dad finds out and he's shocked. Okay. One of the most common symptoms for postpartum depression in fathers is planning. So all of a sudden, dads will start to look at life insurance and schooling and their 401ks, and they start looking at their job, and they'll work extra hours, and they start looking for side hustles. Very, very common. They may also be focused on sales, like saving money and all this stuff. This is a very common symptom, because all of a sudden, dad has to focus on big picture. Okay. And when you get hit with that, sometimes you'll act shocked and scared, because your brain turned on to, oh my God, what do I need to do? Let me start planning. Okay. It's a normal human reaction. It, in my opinion, is not negative. And in fact, I want to make sure that we reinforce, and I hope this dad is listening, that you're allowed to be shocked and scared. It doesn't mean you're not happy. A lot of people, when they have babies in those first couple weeks, it's rough. Newborns are not as much fun as they look like a baby. Okay. And all of a sudden, your entire schedule is completely stopped. And so many people, as part of their mood disorder, will say to me, they'll be like, Samantha, there are days I just wish this baby wasn't here right now. I just want to be able to take a shower like I normally used to. Those same parents would also lay down their lives for their children. They love them so much. And the two things can coexist. You don't have to have a perfect reaction to everything. And that does not mean that you're not totally in it. So you may not be able to convince your partner that you're totally in it. Maybe if she hears this, she might understand a little bit more about your reaction. There's going to be plenty of times that anybody will react differently than we expect. However, do not look at that as a screw up, because that means that your real feelings were not valid. All feelings are valid. It's what we do with them that matters. And so it's important for you to be understanding of yourself and to move forward. If you're excited, tell her you're excited. Okay. How can you show her? You can support her. You can help her plan, and you can just be involved. That's all you can do. Okay. And she was probably just as scared. And while she was excited, when she saw you were scared, it probably scared her. So that's all that was going on, I think. So that was the last of my questions. If any of you guys have questions, you have like 2 minutes or less to ask me. My name is Dr. Samantha. I'm the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions that you've submitted onto the videos on the channel, as well as any questions you put in on Facebook, Instagram, Twitter. We are here every Monday at 9 p.m. Eastern Standard Time because I love talking to you guys. Tonight, you guys were quiet, but other nights, it's wonderful to hear from you. I'm sorry. Please like and subscribe to the channel. Please like and subscribe to the channel. Subscribing to channels on YouTube really helps the content creators out. This is a very big deal for us, and I really encourage you. Please do it. It really helps me out. Hit the notification bell so you can get notified of our latest videos that are going to come out. Share the channel with your friends, family, coworkers, anybody who you think might benefit from this. And frankly, it's probably everybody, because we all know somebody who's about to give birth or has just given birth, right? For those of you who are new to the channel, we were just approved to be a part of the YouTube Health platform. This is an area of YouTube where you can go to get verified health information from verified providers. So they are taking the time to vet channel information and make sure the healthcare providers there that say they're licensed are actually licensed. So we are now a part of that platform, which is very exciting. If you guys want any videos, please give us the suggestions. We look at those questions. I answer a lot of those questions that you guys are putting onto the videos. So that's one of the things I do. That's one of the things I love. We do not have a video to preview for you guys this week, but I do have a couple exciting videos coming up. But please check out our last two videos, are some of my most favorite, which are the top 10 gifts you can give to dads and the top 10 gifts you can give to moms postpartum to celebrate, and they don't have anything to do with babies. My name is Dr. Samantha. I am the maternity mentor. Thank you so much for supporting me and the channel. I look forward to talking with you again. Bye for now.